Good afternoon, everybody. For those of you who don't know me, I'm Jason Bloom, and I'm on the board of the North Dallas Chamber of Commerce. I want to welcome all of you to the North Dallas Chamber's leadership briefing featuring Dallas County Judge Clay Jenkins. This program is sponsored by DART, who is represented on the board by Nevin Grinnell, by my law firm Haynes & Boone LLP, and by Southwest Airlines, which is represented on the board by Steve Cisneros. The Leadership Briefing Series strives to bring business leaders and public officials to the Chamber for the latest information on issues and events impacting our community. And I can think of no local official more suited to speak on these issues than County Judge Jenkins. Now, I could read a lengthy introduction on Judge Jenkins, but honestly, if you don't know who Judge Jenkins is by now, you're either brand new to the area or have just emerged from a years-long coma. And are probably desperately trying to go back to that blissful state. But suffice it to say that Judge Jenkins has served as the Dallas County Judge since 2011, so 10 years now. And since coming into office, he has been faced with and led the county response to the Ebola virus, the West Nile virus, which seem like such trivial viruses now, earthquakes, floods, catastrophic windstorms, tornadoes, catastrophic winter storms, the Real Housewives of Dallas, and of course the coronavirus, among many other unexpected calamities. Now that I say it out loud, his resume kind of reads like the book of Exodus, so next year maybe we'll be faced with an attack of locusts. But he's also done a lot more for the county, which I could walk you through, including in the education arena that does not get nearly as much media attention. He has been faced with some unprecedented circumstances and some very difficult decisions. And whether you agree with all of his policies or not, nobody can deny that Judge Jenkins has always led the county through difficult times with a sense of calm, a sense of purpose, a willingness to act swiftly when action is required, and with the best interest of the citizens of Dallas County at heart. So with that, I'll turn it over to County Judge Clay Jenkins.
Thank you, everyone. Good to see everybody. I'm out here at Fair Park right now. I'm sitting in my car so I can talk to you. But I do want to show y'all something because I think a picture is worth kind of 1,000 words on stuff. And I know, as a business community, maybe you can help us with some of these issues. Got to get my mask on to get out of the car, be a good camper. Hang on one second. Hi, everybody. I'm going to flip my camera around just if I could for a moment. What you're looking at, guys, if I could show you, see all these cars. These are all people on the federal side getting shots. Largely, they're from 17 zip codes or from an area that is below 100% of poverty. Some of those zip codes do include like Lakewood and Lake Highlands and whatnot. So you do have a few people of means that are in there. But if you look over here, you see all these empty slots. So once you get past the federal side, which is about half, you get over here to the state side. And as you can see, guys, there's nobody over there. These are people coming for second shots, and see it's pretty empty. And then here's a bunch of people over here. Here's a picture of the parking lot on our state side. And unfortunately, that's because the state is diverting 59,000 shots as of this week, and it may get to be 100,000 by next week from Dallas County and Tarrant County to places like Lubbock and Tyler and Longview, other small counties. And so the result is, and this is where we need your help, the result is that in a place like Lubbock, as of 2 days ago, 25% of the people in Lubbock County, which is about 280,000 people, about 25% of those folks had already had a first shot. Unfortunately, in Dallas and Tarrant County, neither one of us had broken 14% on first shots. Similar numbers for places like Tyler and Longview, and just about on the exurbs. So in urban counties, and particularly our two, where the shots are being diverted, we hold the distinction of being one of two counties, and by far the most. Let me switch it around for you. By far the most diverted here in Dallas County. They're largely fixing some of the problem in Tarrant County, but they're not doing much to fix it here. And so that makes all the questions you're going to ask me about when can I get vaccinated? When are the teachers getting vaccinated? My mom's been on the list for a long time and she's not getting vaccinated. That's kind of an illustration for you of why that is happening. We don't have any shots. So hopefully that changes. I just got through sending another letter to the governor. And I know a lot of the chambers have joined in to help with that as well. But we're very limited on what we can do. Now, one thing that we are doing in concert with our federal partners, we are opening up federal shots for teachers who live in one of the 17 zip codes or one of those targeted census tracts. When I say teachers, what I should have said are people involved in education and childcare. So you may not have as many teachers, for instance, who live in one of those census tracts, but you may have a lot of cafeteria workers or childcare workers who live in those tracts. So we'll be able to get them a shot. I've talked to John Hellerstedt, who's the state's top health guy over at Dishes today, about the confusing message the state sent to us yesterday. They said include the teachers in the list and get them shots as soon as possible. But then they also said and get the first shots to the people who are the oldest and sickest. Well, as he and I talked, and he knew these numbers, about 90% of teachers are below 50 years old. They tend to be, as a cohort, a healthier group than the people who are already signed up on our list. So if you follow the state's chief directive, it'd be a long time before most of those teachers would get to the top of the list on vulnerability. A lot of the counties are doing first come, first serve. If you follow, not us, but some of the suburbs are doing that. And if you did that, it'd be obviously a real long time since there's hundreds of thousands of people on the list. So ask him, one, are you going to send us a separate allotment for teachers? Two, have you considered sending that allotment directly to the districts and letting the school nurses vaccinate the schools, or sending it to them and letting me get with Dallas County Medical Society, get the vaccinators, and us doing all the teachers right there at the schools? Three, if you're going to expect us to do them out of the shots you're not sending us, then what percentage of the 2,000 shots you sent Dallas County this week would be going to teachers, and what percentage of that 2,000 would be going to people who are, say, 75 years old with underlying conditions who've been waiting on a list since January to get a shot? They didn't have a lot, and it doesn't sound like it, but it was a friendly conversation, collegial, and didn't have much answers, but thought he would have more answers for us, early next week. But so we will announce at 3:00 today that we're going to get some teachers shots, probably starting tomorrow if they'll sign up today. So that's a good thing. It won't be all of them, but there's about 750,000 people who live in those zip codes. So bound to be some of them that live there. Not much I can do beyond that right now without shots, because the federal program is restricted to certain areas. Other thing before I take any questions, the masking, we know masking works. I think as businesses, we need our employees to believe that we care about them and that their safety and they're, taking illness home to their family, not taking illness home to their family is very important to us. We need our customers to believe that when you come into our establishment,
and this may be different for restaurants, but when you come into our establishment, like a grocery store or a dress shop or, whatever it is, you get your car fixed, that we care about your safety. And so, I think most businesses will keep getting people to wear masks. That's the smart play. I think, for restaurants and bars, they probably won't, because if you are willing to take the risk to go eat inside of a restaurant, at 100% occupancy, then you probably recognize that as soon as people get there and sit at their table and start, eating and drinking stuff, the masks are coming off. So I don't know what good I can't really think of any health benefit of wearing a mask for 30 seconds before you sit down. So they'll probably go in a different direction. But I think most of our businesses will continue to have people wear the mask. If there's something that we can do to help in that, we're going to. If we can have which we currently do have, by the way, still in effect, a rule that says businesses must require masks in their establishment. So unless that's knocked down, you've got that to lean on to blame us about. And if it is knocked down, we'll look at other ways, to help you if you choose to do that. We know that if we continue to wear our mask and we have about the level of compliance we have now, and if we get the state to stop diverting shots and keep the feds here, which I think both those things are doable, that we can reach herd immunity by June. So it's 90 days, 90 more days of this, whatever this is. And then we're at herd immunity, and it doesn't mean it's over, but it means it's beginning to be over. And we don't want to spike the ball on the 10-yard line. We sure as hell don't want to claim victory in the third quarter. And so we've got to keep doing what we're doing so that we can win this thing this year. I think we will. So with that, I'll take any questions you may have.
Thanks very much, Judge. A couple from me to start. You mentioned that we have a short supply of vaccines, but tell us, what can we, with Chambers and others in the business community, do to help increase the number of vaccines that are available for those in the Dallas area?
So we got to reach out to Governor Abbott and ask him to stop diverting vaccine from Dallas County. Let me walk you through the numbers, and we can, send you the numbers as well. But each week, the state government gets shots that they didn't pay for from the federal government. Then their job is to get that out to mass vaccinators and healthcare providers and pharmacies so that they can get that out to their citizenry. In week 10, Dallas County got about 43,000 shots. Now, not the government of Dallas County. That'd be Baylor, UT Southwestern, Parkland, everybody together got about 43,000 shots. And then in week 11, which was last week, we got 21,000 shots less than that. And the justification changed over the days, but the number was exactly the same number as the feds were bringing into Dallas for the underserved population that week. So, although there were 3 or 4 different justifications, I'll just point out to you the numbers were the same. Now, the troubling thing about that, of course, is the underserved population, by and large, wasn't already on our list because they're not early internet adopters. And when you take 21,000 out of 43,000, or half the shots, away from the hospitals, the people on their list aren't getting shots, or a lot of them aren't. Then the next week, they took another 11,000 from us. So that's 32,000 right there. But as you're seeing, more and more vaccine is flowing to the states as production increases. So since the week 10 baseline, Texas received another 300,000 shots. Now, if they were allocating them as they previously said they were allocating them based on population, providers in Dallas County would have received 9.1% of that, or over 27,000 more shots. providers in Dallas County received 0 of that. Also, providers in Tarrant County received 0 of that. So I'm just talking to you today about the Dallas County numbers. I don't have the Tarrant County numbers in front of me. But in Dallas County, that's over 59,000 shots to all providers. That'd be City of Dallas, Dallas County, every hospital system, and many other providers that they did not receive, so you did not get. 59,000 shots, to put it in perspective, would immunize every teacher, healthcare or childcare worker, cafeteria worker, anybody involved in your child's education and everyone else's child's education, and 10,000 other people. That's how many shots that we've lost so far. Okay. And with each week that this continues, it gets worse. And so we really have to, reverse that. That's why whether you're on our list or someone else's list, if you've been waiting a long time, people are hearing all these rumors like there's thousands of shots or hundreds or dozens or whatever that the hospitals in the county just throw away at the end of the day because nobody's using the shot, or there's hundreds or thousands of shots on a shelf somewhere at a hospital that nobody is taking because they're saving them for second shots. Here's the reality of that. No shots are wasted. If there's any shot left over at the end of the day, different people handle it in different ways. What we've now gone to doing is we just send a fire truck out to a busy intersection at Fair Park and pull cars over until we have enough arms to fill up the shots. Other people handle it in other ways, but there's no shot being wasted. And every provider, whether it be a hospital or a city, is using every one of their shots every week. They may have 200 left over that they're rolling into the next week, but there's no stockpile here. We're getting them out as fast as we get them. So we got to get that fixed. So please, write, call. If you have sway with the governor, let him know. He will care that you care.
Thank you, Judge. We're getting a lot of specific questions about how people can get shots, and we'll get to some of those in a second. But what about somebody who doesn't necessarily qualify under 1A or 1B, or doesn't have a medical condition but wants to get vaccinated but doesn't fall into any of those categories? What advice would you give to somebody like that?
So go ahead and register everywhere that will take a registration for you, that you're willing to drive to. And 1C is coming out very soon. You may be in 1C. And, I believe the Biden administration is correct when they say that there will be a shot for every man and woman who wants one by the end of May. That means before the end of May, we're going to see a lot more production and supply. You're going to probably see the governor being pretty aggressive on opening things up, which will get you a chance at a shot sooner. It also means with more people in the line, those older and sicker people who have waited the longest or, may end up having to wait even longer. But, that's just my guess on what will happen there. So get signed up. And then, as soon as your group is eligible, then you'll be in the mix.
And how would you sign up? So people who aren't in the know, what would you tell them to do?
So at Dallas County for Parkland, UT Southwestern, Baylor, Grand Prairie, Irving, the Dallas County, all that, you sign up at dallascounty.org. For Collin County and Tarrant County and Denton County, it's pretty much the same thing. You go to their county websites, but then there are one-offs everywhere. So there's I believe the Allen Fire Department has their own sign up. The city of Garland has their own sign up. UT Southwestern does 10,000 a week, first come, first serve, where they drop a link out there between 7:30 and 8:30 on Mondays. So there's a great I'm sorry I don't have it right in front of me, but there's a Facebook group that's like Vaccine Finder North Texas, something like that. That's a great place to go see all the places you can sign up. It's very tedious, but the state doesn't have a one-stop website for this.
And thanks to our good friend Jenny King from UT Southwestern, who just posted that exact Facebook group in the chat. So everyone check that out. First question that we have is from Harsh Agarwal from Bank of America. Harsh, do you want to unmute and ask your question for Judge Jenkins?
Can you guys hear me?
We can hear you.
Hey, Judge, thanks for your time. My question is, I would like to hear your thoughts and if you can expand on the pharmacy strategy that President Biden is working on. I'm sure you're involved. My logic would tell me that, having 200 plus pharmacies inoculating people is probably much more efficient and faster than 5 or 7 or a handful of mega sites that we have around the county. What are your thoughts on that?
Well, I think you need both, right? And so last week we only had 80,000 shots going to the pharmacy program here in Texas. That's our portion of the million that they increased last week from the feds. With the teacher inoculation of the pharmacies, I expect that will increase dramatically next week. And so we'll get more pharmacies in the mix. Now that will be strong preference towards teachers for that group. But I would agree if somebody says, wouldn't you like to see pharmacies at full capacity giving shots at every pharmacy that's willing to give shots? Heck yeah, I would. And so we need to do that. So there's three federal programs that we're looking at in Dallas County. There's the mega site program that I just showed you, one of the places. There's the FQHC program, which is smaller, but will vaccinate, 3,000 or 4,000 people a week. And there's the pharmacy program, which has tremendous potential. I actually have Kroger Pharmacy on site. They're part of our vaccinators here, and are doing a great job here and a great job at their stores.
Thanks, Harsh, for that question. Next question is from Natalie Stores. Natalie, do you want to unmute and ask your question?
Absolutely. And first of all, Judge Jenkins, thank you so much for your leadership over these crazy years. It feels like at the top of the show or at the top of the presentation, all of the things that you've led us through. We really appreciate your service. My question is, who makes that decision to divert our vaccines to another county, and who decides on that county, is who gets our diverted vaccines? Who's responsible for that?
That'd be Governor Abbott. Just, plain and simple. So if you're writing a letter, write it to Governor Abbott. He may tell you that DSHS makes those decisions, but the reality that's coming out, I think you've already seen that when he removed the mask mandate, DSHS was not consulted. When he opened up 1B, DSHS was not consulted. They found out about it in a tweet. These are political decisions to veer from the allocation formula that was in place for the first 10 weeks.
Thanks, Natalie, for your question. Next question is from Anita Eddy with the JCRC. Hi, Anita. Anita, are you there? Can you unmute?
Yep, sorry. Getting off mute. Thanks so much, Judge Jenkins, and also Jeff, for pulling this together. I was wondering, Judge, if you would direct us to a place where we could find out which zip codes are eligible for the upcoming shots and how teachers can sign up for those vaccinations. Thank you.
So if there's hopefully there was a teammate on the call, the best thing to do is post the map link to this chat so that they can all see the map and where it is and where the zip code is. I'll also remind you, I don't want to freak anybody out about this, but this is a federal program. So, people might be tempted to say, well, I live in this zip code, but I think I'll put my sister's address down and pretend like I live in that zip code. It being a federal program, if you get caught doing that, it's a very bad thing. So I would really encourage, I'm trying really hard to get shots for all the teachers and for the people who've been waiting patiently on our list. But the answer is not to try to fudge your way into a federal program. You can get into some pretty serious trouble for that. So can somebody throw the list up? Is any of my team on here? I hope.
Thanks, Judge, and thanks, Nita, for asking that question. We'll look out for that list.
Okay.
Next question is from Michelle Madden from the Grand Prairie Chamber. Hi, Michelle.
Hi. Yes, I was wondering, thanks so much again for having this event today, and thank you, Judge. I was wondering, with the load that pharmacies often have just running their own business, do we think that there is a capability, manpower-wise, for them to be administering shots, even though it is a great and very convenient location?
Yeah, I think so. Remember, that's why you need an all-in approach. You need your mega sites, your smaller sites, and your pharmacies. So what you got to think about is, let's take the two big mega sites. On a busy day here, we'll do 10,000 people. But if you had shots at all the pharmacies, and all the pharmacies just did 75 shots a day on average, like they do flu shots, they would match us or surpass us every day, right? So it's the new problem. The problem that I have a different problem all the time in disasters. Like, you have a tornado, you have a different problem on the first day than you do on the third day and on the 10th day, etc. So we're already looking at the next problem, and the next problem is not getting vaccine; it's distributing all the vaccine that we get. So getting our pharmacies ready, trying to get our schools in the mix to be distributors. I'm asking all the schools already to identify large football stadiums with big parking lots, so we can turn those parking lots into mega sites. Now, those mega sites might not do 10,000 a day; they might do 3,000 a day. But looking at how we get that out, we need to, everybody to do it, and also PCPs, right? Primary care physicians can do a lot of this too. It's getting them shots. Before our shots were being diverted, I was in conversations with private physician groups, the big private physician groups, about getting a little bit of shot every week and hitting people with that, and all of our FQHCs about taking shots every week, and different hospitals and whatnot doing 500 or 1,000 shots a week, and then suddenly we lost all of our shots.
Thanks, Michelle, for that question. Next question is from Andrea Hollingsworth. Hi, Andrea.
How are you? Thank you, Jeff, and thank you, Judge Jenkins, for doing this for us. What is being done to ensure the underserved communities are receiving a fair allocation of vaccinations, especially since the folk in those communities are essential workers and have been negatively impacted by COVID the most?
Well, on the state side, not much, because they leave it up to the counties, and many counties have done a first come, first serve list. And so that tends to, by definition, not be those communities. On our side, we were fortunate to be able to reach out directly to the White House and partner for this federal program, which has already gotten us, 48,000 shots, which have gone to people who live in the 17 most vulnerable zip codes as defined by the Parkland Center for Clinical Innovation and the Community Health Needs Assessment done in partnership, with government and local hospitals. It is expanded to include census tracts in every city. Well, not every city, some don't have any, but in cities that have a census tract that is below 100% of poverty. So for instance, you take a suburb, that suburb may not be in one of these 17 zip codes, but they've got a census tract or 3 or 5 or 6 that are below 100% of poverty. All those folks that are on the list are getting appointments for shots pretty much as soon as they sign up now. We are running right now. Our registration is barely keeping up with our federal shots for those. So we may see it raised to census tracts at 125% of poverty, but we do need people to continue registering people. And keep in mind, as frustrated as I am, and if you can't tell, I'm pretty frustrated, with what the governor is doing here. A lot of our people who are middle class are being able to go to Tyler and Longview and Grayson County and some of these places. That sucks. I'm sorry, excuse me. It's frustrating that they have to drive that far, but they are getting shots. They're just having to drive 2 hours to get them.
Thank you. Thank you for your response.
Yeah.
Thank you for the question, Andrea. Next question is from Sarah Stashuk. Hi, Sarah.
Hi, thank you. I appreciate your time today. I just had a couple quick questions. I'm looking for what I said. I was just curious if there was any concern about the, some of them, you mentioned people were out on the street corner giving them out. And I had some concern, and I was wondering if you shared it, that they might not be good anymore and effective if they're not being properly stored. Are you confident that they're always still effective when people do get the shots?
Oh yeah, absolutely. So
Okay.
each shot has to be thawed after each vial is thawed after when you're going to use it. As long as they're not thawed, so when we get them, we keep them at the appropriate, refrigerant temperature. They can last for each of them can last for about a month at a minimum. And we don't keep them more than 4 or 5 days. So that's not a problem. And once they're thawed, then you've got in most cases about 12 hours to use them. Mm-hmm. So what we have is there's a building on site here and at all the hospitals with super cold refrigerants in it. And they take them out, they thaw them, and they're only drawing sufficient amounts for the cars in the line or the patients scheduled for the next 2 hours or however they're doing it. At the end of the day, you might have a situation where there's been a miscount, people hadn't shown up for an appointment. So you've got, at a huge site, you've got 25 shots left over. At a hospital, you've got 3 shots left over. Sometimes the doctors will call their neighbor and say, I've got 4 hours until this shot expires. Can you get in right away? Here, we just pull people off the street. We don't shoot them on the street, but we pull them off the street, bring them down into a clean environment, and a medic gives them a shot. And if we got to a situation where a shot expired, and I'm sure somewhere in Dallas County a shot is expired, but by and large, statistically, that's just not happening.
Okay. Thank you.
Thank you, sir.
I had one more that was on there. Am I allowed to ask?
Yeah, go ahead. Go ahead.
Okay, sorry. Okay, so are we getting, I'm sorry, I forgot what I was asking.
That's okay. Take your time.
Where is my name? There were a lot of questions afterwards.
Sir,
are we protected against the new variants?
So, yeah, it's a very interesting question. The broad answer is yes, the variants we have now. We have B117 here. We had 5 of those yesterday. That's probably be the dominant strain before long. That's the one that started in the UK and is 70% more transmittable, but probably not that much more deadly, if at all. And we are very well protected with all 3. Keep in mind, a lot of people have asked the question of, well, Johnson & Johnson's numbers were lower than Moderna's numbers, so is it an inferior vaccine? They're all excellent vaccines. Johnson & Johnson was tested in South Africa, which is the most virulent strain. That is the one that we're all most worried about getting here, and the one that we're worried about the viruses or the vaccines being less effective against. So you can't really compare their numbers I'm told from scientists, you can't judge from that because they're different populations at different times of the virus progression that they were tested. What we know is that all of them virtually stop the possibility of you getting hospitalized or killed from COVID. And that's, after all, that's why we get the vaccine. It's not, if people are thinking about which vaccine should I get, don't think about that. Think about why you're asking to get a vaccine in the first place. And that's because you don't want to go to the hospital, and you don't want to die. And all 3 of them, will make that statistically impossible.
Thank you, Sarah. Thanks, Sarah, for the questions. Next one is from Valerie Hawthorne with North Texas Food Bank. Hi, Valerie.
Hi, Judge. How are you?
Hey, good, Valley.
So President Biden is sending the food banks millions of masks that we are to distribute in our food lines and pantries, but we'll probably have some left over. Who are we missing? Who do we need to get those to, other than those that we're seeing in our food distribution lines?
You know, Valerie, it's a great question. If you get them to me, since I'm vaccinating the underserved community, and that's pretty much the only group that is, except for others, one in Tarrant County too. So if you get it to me and you get it to Globe Life Park, then we can have our medics ask people as they're giving them a shot, would you need some extra masks for you and the family? We can give them a package of, whatever, 5 or 6 or 10 or whatever you have.
Okay, that sounds great. I'll get with Jason. Thanks.
Great.
Thanks, Valerie. Thanks for doing that, by the way. Next question is from Clifton Miller. Hi, Clifton.
Good afternoon, Judge. Greetings. One of the things, what COVID has revealed is, or the impact of COVID is the disparities in certain communities of color, but there are also other disparities like transportation challenged populations. It's one thing to be transit dependent, it's another thing to be transit challenged. So educational facilities tend to be neighborhood based and may be more accessible, but what considerations are being given to those transit challenged populations? Be they aged or disabled or otherwise?
So that's a great question. Let me flip my camera around real fast. Okay. So if you look out here, you can see that bus right there and those soldiers sitting here. This is our bus lane. So that is a bus coming from a church or somewhere. Those folks are from an underserved zip code and they're getting their shot. And then you look over here at this bus, that's a DART bus. So they can take the DART in here. And there's a lot more than that, but I'm showing this one little piece. So they can take the DART in and we pick them up in a little DART bus and we bring them right over and get them their shots. And then we have buses, for instance, tomorrow we'll have a lot of buses coming from Vickery Meadows where we've been, marketing, go to these locations to get on the bus. But then you're also right that it is getting this stuff out into the neighborhood. Right now, the state is preferring a mass vaccination model. But we're going to have to build that throughput in the neighborhood at all of our schools, our FQHCs, our primary care physicians, so that people don't have to travel so long.
Thank you, Clifton. And we've got a follow-up related question from Brittany Tree with Send a Ride. Hi, Brittany. How are you?
Hey, I'm good. How are you?
Great.
Yes. So for me, older adult transportation is really important, and that's something I've been working on for several years around Dallas County. And I know that it is an issue for some older adults and, the homebound folks, the folks that can't afford to pay for DART even, or can no longer drive. So I was wondering if there was a plan for that as well.
So 2 things on that, and I could be wrong. I'm 90% sure I'm right. And if I'm not, Lawrence text the group and tell them I'm wrong. But I believe, speaking of DART, that if you're getting your vaccine here, you can ride free. But we do have a lot of people who, it doesn't matter whether it's free or not. They don't have anybody to drive them. They're in a place where it's just not safe for them to even leave the house. And so we are starting a program this week with, I believe it's DeSoto and Lancaster. It's a very small pilot program to get the people on our STEER list, which stands for State of Texas Emergency Assistance Registry. These are folks who've said, hey, if there's a storm, I can't get out of my own house. You got to help me. That's not a very big list, but we're working that list. We're going to work visiting nurse, home health care, and other lists with our fire departments to try to get those folks right there in the house. That program is going to take a few weeks to really pick up steam. And also it's a function of the state giving us the shots to do it. But we've got our fire departments talking about it. They're fired up and ready to go. I just need to get them some vaccine.
Thanks, Brittany. Next question is from Randall Chase with the Cedar Hill Chamber. Hi, Randall.
Afternoon. Thanks for coming on here. Mayor Jenkins, this is great information. Really appreciate it. I was going to ask if there's any plans to create mobile vaccine sites to be able to visit communities and individuals that either can't make it to the sites or aren't DART accessible, or possibly homeless individuals that might not be able to make it out to those locations.
So we have a couple of those going on right now. Even as we're talking today, our homes vans, which are Parkland vans that do mobile service to the homeless community, are driving around the homeless encampments and trying to convince people. Here comes a bus. It looks like he's about to hit my car. Okay, he barely missed me there. So anyway, they're driving out. They're finding those homeless communities, and they're vaccinating people. And then we have another program we're starting up called Vaccination Sundays with Richie Butler, who's a Methodist minister here in town, and many others, where we'll have some mobile clinics spearheaded by UT Southwestern. Again, we have to get the shots from the state so we can do all these things, where people will have mobile clinics on Sundays at synagogues and churches and mosques to do some of that. So yeah, those things are being looked at, and it's just we got to get the shots and but we're building it as if the shots are getting here. When we built this mega site, we built it without a contract from the Fed, without the Fed saying they would come here, without the state saying they would send us shots. But if you build it, they will come. I've heard that in a movie, and it's kind of our theory here.
And Judge, on the subject of mobility, we've got Nevin Grinnell with DART on the line. Nevin, did you want to give a quick update on what y'all are doing relative to DART?
Am I right that it's free to come here, or is that still cost?
Almost. We are working on that currently. So 2 things. We are providing rides through our mobility management group. So those are those folks that have mobility challenges. And then through our regular DART system, we are working on a free rides program. We're pretty close to deploying that. We just have to walk through all the processes that we have within DART to get that mobilized. So that should be coming out shortly.
Cool.
Thank you, Devin, for that update. Next question is from Jason Bloom with Haynes and Boone. Hey, Jason.
Hey, Judge Jenkins, I know the answer to this may be a bit of an unknown, but just based on what you've been hearing from the folks you've been talking to in the medical community, is this vaccine going to be something that needs to be renewed annually for a large segment of the population, or do we think it's going to have more of a lasting effect, understanding that different variants and strains may change that calculus?
So that is a very much of an unknown thing. As some of you know, after Ebola, but stayed good friends with many people that were involved in that, and some of those people like Dr. Fauci and Ron Klain are very involved in what's going on now. So based on what I'm told by my friends, here's the best guess. The most likely next shot you're going to need is for the South African variant. It will eventually get here, unfortunately, and that'll be a booster shot. And the manufacturers and National Institute of Health, the people that are working on this for the government, feel very confident that a booster can be made that will protect sufficiently against that virus. Remember also that the 3 that we have now are quite a bit of protection against the South African variant, but they can do better with a booster. So that's probably what you're getting next. But it is unknown. It's possible that, like the flu, the mutations as the coronavirus matures will be like the flu, and we'll end up having to get a shot every year. That's a possibility. That's not happening yet.
Thanks, Jason, for that question. Next question is from Matt Adamczyk. Hey, Matt. Matt, are you there?
And I can tell you don't live in a Czech community because that's Adamczyk. I'm from Waxahachie, and Ennis is our next door rival, so I know what that is.
Matt, have I been pronouncing your name wrong all these years and you haven't told me? Matt, I don't know if Matt's on there, but he's got a logistical question about where he should go for his next shot, which is due next week.
Okay.
Should he go to Fair Park?
You should go to wherever you got your first shot, Matt. We don't really have a good mechanism. It's quite the ordeal, actually, if you got your first shot in another state to get you a shot here. It's similar to the paperwork in arresting someone. I mean, really, it's ridiculous. So you need to go back to wherever it is you got your first shot.
Thanks, Judge. Similar question on logistics from Ramon Miguez, our former board chair. Hey, Ramon.
Judge, thank you very much for joining us, and thank you for doing all that you're doing to keep our community safe. My question really has to do, or comes from conversations that I've had with friends across the Metroplex that say that if you have registered with one of the surrounding counties, Tarrant, Denton, Collin, that you can actually check your status in line. Do you know if the Dallas County site will offer that?
No, we don't have that capability at this point. And they're telling me also I've got a media availability apparently that's happening now to go over school teachers with all the media. So this had to be my last question. Sorry. We don't have a capability to do that because we use the vulnerability model. So if you're on the list, if you're in a first come, first serve list, like in Denton County or Collin County, then if you're number 31,210 to sign up, they can tell you when they get to their 31,210 customer. But when you're on a vulnerability list, as more and more vulnerable people sign up, maybe you're 50 and more 75-year-olds sign up, you'll be pushed down. As more and more vulnerable people get shots, you'll be pushed up. So there's not really a mechanism to do that. We are working on a system where we can take snapshots for a week or two and give you at least some notice as to how likely you are to get a shot in the next week or two. But the system is not set up to do that yet. Hopefully in a week we'll have those. But that's the price that we pay to do the most vulnerable people first, which is why our hospitalization numbers, by the way, here in Dallas, our COVID percentage of hospitalization is down around 6%, but it's still up above 10% in our two northern counties. I got to jump off. They're on me about the media waiting on. Thank you, guys.
Thank you very much, Judge Jenkins. We really appreciate it. Jason, you want to close us out? I think we already lost the judge.
Yeah, I don't think we have Judge Jenkins anymore, but as a small token of our appreciation, so everybody knows on the call, we will be making a donation in Judge Jenkins' honor to the Austin Street Shelter at the end of the Chamber's fiscal year. And the line, as is typical, will remain open, usually for 15 minutes, but maybe for 25 minutes since we're ending a little early for networking. So please feel free to stay on.